are you?
I sure am not, no. But listen, the good thing is they stay up very late, so I have the morning to myself, so it works out. We're adapting.
Yes, there was a special on CBS News this morning, and they were talking about some camp that was canceling, overnight summer camp, and it was canceling for the first time in 100+ years.
Yeah.
And how they had gone through world wars and something. And I said, yeah, no summer camp.
Yeah, not this year.
No summer camp. But, oh well.
Not this year.
Where was that camp, Kim? Was it in Texas?
No, this was maybe North Carolina or Virginia.
Yeah, those, I went to camp in Maine, all those sleepover camps, I mean, most of them have never, ever canceled. And
yes, and that's what they were saying. They had never canceled, but it's the new year.
Yeah, yep.
All right, I'm going to mute before the governor comes in because he'll come in telling me something that the Alex is going to join us.
Courtney has approved these budgets.
Oh, we just got them. Did you go on mute?
You might want to be on mute there for a minute.
Good morning, team.
Good morning. My name is Andrew Doss, and I'm honored to be serving as the director of the Resilient Louisiana Commission. Welcome to this Friday, June 26th meeting of the Commission. It is now called to order. Thank you to all Commission members taking part. Thank you as well to all the public who are joining us. Your attention and involvement is crucial to the success of the Commission. The Resilient Louisiana Commission appreciates the invaluable input from residents across the state and industry sectors, and we welcome your continued participation and insight. We're using a new format today, the Zoom webinar. Some of you may already be familiar with it. Any members of the public used to the old format who may feel distanced out there on the YouTube live stream, I want to assure you that we're not trying to diminish your participation, but quite the opposite, trying to ensure that safe participation is possible as we safeguard against some valid Zoom bomb and security concerns, especially with our first special guest today, Governor Edwards. I'd like to give a big thanks to Donald Dunbar for putting in a great deal of research and time to set this up, and it seems to be going smoothly. We very much want to hear from you, so please email comments and questions to resilientlouisiana@la.gov. Again, that's resilientlouisiana@la.gov, and we'll be live feeding those emails, be able to see them as we're going. These will also be posted in the chat to be seen and addressed as we are able, like usual. Additionally, the public can sign up for meeting email alerts and access Resilient Louisiana Commission and Task Force meeting schedules, agendas, minutes, audio recordings, reports, and other documents of interest at opportunitylouisiana.com/Resilient Louisiana. At this point, we'll conduct a roll call. First, I'd like to recognize that I do see the following commission members present: Secretary Don Pearson, Secretary Kimberly Lewis Robinson, Scott Henskins, Bill Hogan, T. Martin, Jade Brown Russell, and Tim Temple. I'll call out the rest of the roll call. Is Terry Sterling on? Co-Chair Terry Sterling. Commissioner Jay Darden. Dr. Jim Richardson. Representative Paula Davis. Senator Ronnie Johns. Lieutenant Governor Nungesser. Michael Lafitte. Walt Leger. Oh, I see Walt. I also see Tyron Picard.
Here.
Sonia Perez, I think, is not going to be able to make it right at the beginning here. Louis Wren. Okay, try that one more time. Co-Chair Terry Sterling. Commissioner Jay Darden. Dr. Jim Richardson. Representative Paula Davis. Senator Ronnie Johns. Lieutenant Governor Nungesser. Michael Lafitte. Sonia Perez. Louis Wren. Okay, that gives us 1, 2, 3, 4, 5, 6, 7, 8, 9 members. We don't actually have a quorum yet, but that's okay. We're just going to be doing some discussion today, not needing to vote on any decisions. But just to be safe, we are authorized to meet remotely in accordance with Executive Proclamation JBE 2020-75. Now, if everyone could please mute themselves for the remainder of the meeting, except for those who will be speaking. I'd like to invite our 2 co-chairs, Secretary Pearson, Secretary of Louisiana Economic Development, and if she is on yet, Co-Chair Terry Sterling, Healthcare Management Advisory Consultant, to make any opening remarks they would like.
I just spoke with Terry a few minutes ago, so if she's not on, I know she's fighting some technical issues and she'll be on here shortly. Terry, are you there? All right, well, we're going to proceed. Governor, thank you for joining us this morning, and I'll be brief. There's not an introduction that's needed here. I do want to pass along to you that one of our large companies in Louisiana yesterday, employing more than 800 people, the executive officer of that branch of their business asked me to pass along to you that he applauds your decision to extend phase 2. He knows it was a difficult thing to do, but that you're protecting health, and he's proud of your leadership, particularly as we watch what's happening in surrounding states. So with that, I would like to turn the floor over to Governor John Bell Edwards. You're muted, sir. There we go.
All right, thank you. So you turned over the floor to me. I think you turned over the Zoom computer to me, whatever, but thank you, Don. And Terry should join us in a moment. I want to thank both of you for your leadership of this effort. And I want to thank all the task force chairs as well. I just thought it was time to get on the phone and give you all an update, to thank you, and then to ask for some additional assistance. There have been obviously some significant events and numbers and data that have come in since the last time that we spoke. As you all know, on Monday of this week, I announced that the state would not be moving to phase 3 today. Today is when the proclamation that put us into phase 2 ended. But I've decided to stay in phase 2, and that will last for another 28 days on that proclamation. Now, we will continue to receive data every day. And about every 7 days or so, we're going to take a hard look at it. And so if the situation allows us to, we can get to phase 3 before the 28 days expires, but it'll be driven by the data, because we're going to apply the White House phased guidelines in terms of reopening, which has those gating criteria. And as you will recall, those gating criteria deal with the number of individuals who are presenting themselves to emergency rooms with COVID-like symptoms, something we call syndromic surveillance. Secondly, the number of cases, people with COVID-19 in Louisiana. And we look at that in 2 ways. One is just the raw number of cases. The second is the positivity factor of the test that we're administering. So are the cases going up or down relative to the number of cases that we are, I'm sorry, number of tests that we're administering? And then third, you look really hard at hospitalizations and make sure that you're on track there and not unduly eroding the capacity to deliver healthcare for those individuals who need it. And by the way, when you do that, you're not just eroding your capacity to deliver healthcare for COVID patients, but for any patient, whether it's a heart attack or a stroke or an automobile accident victim or whatever. And so most of our focus is dealing with COVID, but there is a relationship, especially in the hospital setting, to other things as well. I don't have today's numbers yet. I should get them in about an hour. But I want you to know that yesterday we reported 938 new cases across the state, and that was on 12,160 tests. That means that as of today, we're at well over right at 53,500 cases in Louisiana since we started. Not all of those are active because a number of those people have recovered. But one of the things you should know is that for a number of weeks, the number of recovered people was greater than the number of people who were testing positive. So we were actually making progress towards reducing the overall disease burden in the state. That is no longer the case. The number of people testing positive now exceeds the number that we're presuming to recover. And that's only those people that we are testing. Everybody needs to remember that the best estimates from the CDC are that 25 to 40% of the people with COVID-19 are asymptomatic, and they're not going to be tested in all likelihood. And so the amount of disease out there the number of cases is much higher than that. Other developments that are not so good is that as you will recall, that 2.5 months ago, we were number 2 in the country in per capita cases. We made steady progress week after week after week and got to number 10. We have over the last week moved back to number 7. So we've passed back over states like I think Maryland, Delaware, and Illinois. I think were the 3 states. So the additional cases, the additional hospitalizations, and by the way, as of yesterday, we gave up all the gains on hospitalizations that we had made over the course of June. We are now back to where we were at the end of May. And so that's a real challenge for us as well. Yesterday, we had 12 new deaths, bringing the total deaths to 3,039. And the way this works sequentially, and I think we all know this, it's just important to review it on occasion, is if you bring people into contact with one another in an unsafe way, meaning they're not wearing their masks, they're not keeping distance and not washing their hands and all that sort of stuff, that contact is going to produce new cases. But there's about a 14-day lag between when that exposure happens and when the case develops. When cases develop, then hospitalizations are going to happen, and there's another lag between those two. And when hospitalizations develop and increase, then the deaths are going to increase, but there are lags there as well. And so if we could snap our finger right now and get more compliance on our mitigation measures, we're 2 weeks before that shows up in terms of fewer cases. But the sooner you start getting more compliance, the better off we're all going to be. You all need to know also that the positivity factor has been inching up. So while we're given many more tests than we were before, the most telling stat about that is that the percentage of tests administered that are showing a positive result is actually growing. And that means that we have more COVID-19 than you always knew that if we increased testing, we were going to increase cases. But the increased cases that we're seeing are not fully explained by the fact that we are increasing our tests. And we also know that somewhere around 7% of the cases are coming from congregate settings. So well over 90% of these cases are coming from community spread. That is also incredibly important. So how are we doing on tests overall? Our monthly goal that we worked out with the folks in Washington at the White House Coronavirus Task Force and the CDC and HHS, we have a goal to test 200,000 individuals per month in Louisiana. That's 4.3% of our state's population. Today is the 26th, and we're not counting any numbers today. We've already tested more than 257,000 individuals across the state of Louisiana. So our testing is robust, it's growing in a big way, and I think that that's incredibly important. And you hear some conversation nationally, and I guess here in Louisiana too, about, well, if we would just slow down testing, then we wouldn't have the cases. Well, that is completely erroneous and foolish. The cases are there. If you're not testing, you just don't know where they are and who's got them, and you don't have any ability to try to do the contact tracing and other things necessary in order to keep those cases from spiking further than is absolutely necessary. And I want to tell all of you that I know that it is disappointing that we're not moving to phase 3, but quite simply, we don't meet the criteria, the gating criteria to move to phase 3. The Office of Public Health did not recommend that we do so. I also called Dr. Tony Fauci the other day to make sure he knew where we were on the data and what my decision was, and he thought that was the correct decision to make. If you're looking at what's happening around the country, you know that the cases are spiking in places like Arizona, California, Texas, Florida, and other places to very, very significant degrees. And so we're not the only place where this is happening. And in Texas, you may have seen that the governor issued an order today where he's going to close bars. He's going to cut restaurants back from 75% to 50% occupancy and so forth. Now, what I have decided to do is not to go backwards in terms of imposing more restrictions. We're going to pause where we are and try to get more compliance. And so while I'm on the phone thanking you all for your work, because your work has really been incorporated into the proclamations and into our guidance on open safely and so forth, quite simply, I need more compliance. The state of Louisiana needs more compliance. The businesses in Louisiana need more compliance, because what we don't want to do is go backwards. But what we cannot have happen in Louisiana, and what I refuse to allow to happen, is that we threaten our ability to deliver health care to people who need it. We're not there yet. While we have increasing hospitalizations and the gains from the month of June are gone, we're still not at anywhere close currently to exceeding our capacity to deliver health care. But we are headed in that direction, and that's why we have to stop what's going on. And so I'm asking particularly all of our task force leaders to work with all of the folks in your sectors to make sure that they are doing everything that they can to gain compliance with these mitigation measures. We know that they work. I am absolutely convinced that easing the restrictions isn't the cause of the spike in cases. It's the degree to which people, individuals, the public as well as in business, are not complying with the mitigation measures that we have in place. Obviously, the most important one is wearing a mask. And we know that the mandate requires that businesses who have employees who are coming into contact with customers have to wear masks. And there's no room for any deviation from that. We need the general public to do a better job of wearing those masks as well. But we've got to do that. We've got to maintain our social distancing between individuals who are not from the same immediate households of 6 feet. We've got to make sure that we're washing our hands, that people stay home when they are sick, and that we do everything to protect the most vulnerable among us. You all know who they are. They are the people 65 and older. They are people with chronic underlying health conditions like diabetes, like hypertension, kidney disease, heart disease, obesity and so forth. One of the most disturbing trends that we've seen is that the age group that is contracting this disease in the biggest amounts right now happen to be between 18 and 29. And literally within that group, it's really 18 to 21. So that tells me that we have a lot of young people, those people who've just graduated high school, those people who are in college, who are not following these mitigation measures. They continue to congregate in close proximity without their masks on and so forth, and doing so for long periods of time, and they are contracting the disease. And it may be true that they are best able to withstand it, but the fact of the matter is some percentage of young people are going to have serious consequences as well. Some of them have these underlying health conditions, and some who, as best we know, are completely healthy still have tremendous difficulty and sometimes can die from this disease. And those who don't die, they have organ damage that is going to last with them, especially in their lungs, for example, that could last with them forever. But on top of that, even if a young person isn't going to have any of those issues, if they contract the disease and they go home, they're going to give it to mama and papa and aunt and uncle and grandma and grandpa. And so we have to do better. We know that we're tracing too many of these cases and these exposures back to bars. We know that this is happening in the bar area of restaurants as well. And one of the things that we're going to have to do if we don't want to impose more restrictions is we're going to have to get better compliance with our current restrictions and current mitigation measures. And we're going to do that. And we're going to do a more robust job across the state of Louisiana in responding to complaints that we receive, and doing courtesy visits and making sure that establishments are operating in accordance with these mandates. And where they're not, we're going to spell it out to them what they need to do to change. We're going to follow up those visits with additional visits to see if those changes have been made. And quite frankly, where they haven't been made, people are going to be shut down. We're not going to allow the bad actors to require the entire state of Louisiana to move backwards. And so the Office of Public Health will be working with the Fire Marshal's office and with ATC, for example. And so I'm asking you, I don't want to shut a single business down, not one. But I will do that before we have to go back a phase. And before we allow bad actors to have a negative impact on the state as a whole. So I'm asking for your help within each of your task forces, within your sectors of the economy, to do everything that you can to gain compliance. And where you cannot gain compliance, help us, because we'll go in there and take the action that is necessary. But we cannot continue on the road that we're on with more cases, more hospitalizations, without running the risk at some point of having to go backwards and put more restrictions on the economy and on the state as a whole. And we don't want to do that. We really don't want to do that. So I need your help on that. And that's why I wanted to talk to each of you today. We've got some work to do, and we're not where we want to be. And I think people became complacent because day after day, week after week, we were reporting better numbers. But the fact of the matter is they're not getting better, they're getting worse currently. And before they get out of control and threaten our ability to deliver health care, we got to get more compliance. So with that, I'm going to yield the floor, the virtual floor, back to Don and to Terry if she is on. And I'm sorry. And Don, Alex Bu is on. So Dr. Bu is at the Office of Public Health, and he has been working this issue from the very beginning. And I would like him to come on and add any comments that he has, because he may have seen something over the last couple of days that hasn't even been related to me yet. But I'd like for Alex Bu to be able to speak to the group for just a couple of minutes as well.
Thank you, Governor. We'd love to hear from Dr. Bu. Dr.
Well, I
Bu
was-
may be muted.
I was told he was on.
We do have a tight security network on today, so if it's on the YouTube side, it may be
Can you hear me
difficult.
now?
Yes, Dr. Bu,
I
coming through.
was trying to join by phone. I'm going to use my computer instead, since I guess you couldn't hear me talking on the phone. Sorry about that. Just thank you, Governor. I actually don't have much to add there. Thank you, Secretary Pearson. I will see if I can share my screen with all of you. Are you seeing the gating dashboard in front of you? Yeah,
Yes,
so just
we are.
to add just some data to what the governor was just saying. You've seen us talk about these gating criteria before. We look at syndromic surveillance, symptoms of COVID-like illness, people showing up to the emergency room with complaints of the classic symptoms of COVID, and then we compare that to the overall proportion of people seeking care at emergency departments. In this curve, we have what's called the epi curve, or an epidemic curve. This is showing you new cases and their change over time. And we have these labels here for whether the new case is showing a downward trajectory, whether it's showing rebound or not in a downward trajectory. Here we have in the yellow bars, the percent positivity, the proportion of tests that are coming back each day that are positive. And in the purple line, you can see the overall amount of testing that we're doing, which we've been very successful in increasing over time. And then this last panel here is hospitalizations. So these are running averages of COVID patients in the hospital. And what we do is we highlight the last 14 or 21 days, which we can toggle between, to look at how things have been going with trends in hospitalizations. And then I'll go through some of the regions, but just at a high level, what the governor was just talking about is we're seeing these trends now of increases in all of these metrics. So COVID-like illness is now taking off, which means we're seeing more people showing up to emergency departments. We also know through talking with folks at Blue Cross Blue Shield that they're seeing a significant spike in COVID-like illness being presented to the outpatient centers across the state, which was not something we saw in the initial epidemic. So they're at really the highest levels they've ever been. People showing up saying, I think I have COVID, and being tested. That's probably why we're seeing also such high rates of testing. And as the governor noted, we are still below 10% most days, but we've had several days here in June where we had above 10%. And where we were before was much more in the 6 or 7% before we moved into phase 2. So now what we're seeing is a higher level of percent positivity, percent of those tests that are returning, despite the fact that the number of tests returning is much greater. And what that means is this increase that you see here in the epi curve, this sort of takeoff that's red, is real. This is not testing. This is not just we're looking for more places and we're finding more places. These are people in the community with COVID and significant increases there. I'll also point out that we've been doing a lot of testing in congregate settings, in nursing homes, prisons, adult care facilities. And day on day, we're seeing less than 10% of the results that we're seeing come in actually associated with those congregate settings. So the places where we're doing population level testing and finding asymptomatic people are not really driving the majority of what is being seen in the community, which are symptomatic cases, which are really the tip of the iceberg. So that's very concerning, but most concerning is that this graph for a long time was not showing increase in hospitalizations. For a consistent period of time, it was decreased. Last time we showed the data to the public, this was actually plateaued. It looked a lot more like the 21-day trend, where you can see that the slope was 0.3 or 0.03. So it was increasing, but not yet actually meeting the criterion of having a slope that's greater than 0.1. But when we look at the last 2 weeks, we look just at the last 2 weeks data, the slope now is 0.14. It is a clear increase in hospitalizations at the state level. We'd been seeing that at the region level, but now it's impacting the states. Quickly, just click through some of the regions. We can see that the pattern is similar in multiple regions. We have not yet tipped up increasing hospitalizations in region 1, but at 0.09, we are very shortly going to see, if the trends continue, increase in hospitalizations in region 1. We're already seeing increases in cases, increases in COVID-like illness. When we go to the Greater Baton Rouge area in region 2, increase in cases, increase in illness most recently, and hospitalizations no longer seeing the decline. And I think, this plateau could turn into increase. Region 3 plateaued, increase in cases, increase in CLI. We do more robust analysis on this, but I'm moving through it quickly for you. Region 4, so this is Acadiana, certainly a significant increase in symptomatic individuals in COVID-like illness, increase in cases. I think these green bars will turn to red once we have the cases, the most recent case data coming in, because again, our data lags because of the time it takes for tests to be performed, for them then to be reported to us. So I think we'll see that there's continued increase here, and certainly the hospital trajectory very concerning in Acadiana. Same thing is true when we look at the area around Lake Charles, significant increase in COVID-like illness, significant increase in cases. And right now we're seeing this increase, but plateaued activity in hospitalizations. We look at central Louisiana, we had an increase in cases. It's now looking like it may be coming down. We'll see if this is actually a real come down or if it's a plateau. Hospitalizations, again, trending up, but with some downtick recently. COVID-like illness, however, going up. And that's really the first sign you would see of trends continuing to increase. Region 7, the Caddo-Bossier area, where we had been seeing decreasing among most things, still seeing a decrease in COVID-like illness, but cases are on the rise, as are hospitalizations. When we look at Monroe, where we'd had a lot of issues traditionally with control, here we have plateaued COVID-like illness. This long, slow march up has started to show some decrease in cases, though obviously we need to manage that with the level of testing that we're seeing reported in. So as this testing report increases, we may see that the cases increase too. And hospitalizations are starting to make a gradual decline. So we're watching that closely. And then finally, Region 9, which tracks a lot with Region 1, increase in cases, increase in testing, and a decline in the speed of decrease in hospitalizations. So these are the canaries in the coal mine. These are signs that we have a problem on our hands if we don't turn things around, to the governor's point. And as was true with the original epidemic, with the original rise in cases that we were able to decrease by having people stay at home, to get us out of this position, we're going to need everybody in the public support to actually wear masks, keep socially distanced. We need none of this to be seen as political messaging, none of this to be markers of where you stand politically. This is about keeping our neighbors safe. This is about wanting to have businesses function again. This is about wanting to be successful as a state and really get past COVID. But we are so far from that right now. But it's within all of our hands to try to turn that around. I appreciate your help. And with that, I'll hand it back over to Secretary Pearson.
May I ask if it's possible to share that link? Is that a public document or public resource, or is that something that
it is not a public facing dashboard?
Okay. Thank you, Doctor. I understand.
Hey, Don, before you take over, I forgot to mention one thing. This week, Dr. Kate Brumley, the new State Superintendent of Education, released some guidelines on school reopening. It talked guidelines and resources. I was able to sit with him and review those with him. He developed those working with the Department of Health and the Office of Public Health. We don't know where we're going to be 2 weeks from now, much less August 10th or 15th when school resumes. But we are working very hard to make sure that we can have, if the situation allows, and I hope and pray that it does, on-campus instruction with our students, K through 12, all across the state of Louisiana. But what they've done, and I think it's appropriate, is they have developed guidelines by phase, because they don't know what phase we're going to be in. And even if we're in phase 3 or whatever at the beginning of August, there's always the chance that at some point this fall, the number of cases goes up dramatically and we end up having to impose more restrictions. And so they have a lot of contingencies based in this. And they have different guidelines per phase. So I did want people to know that those guidelines are out there. As we learn more about the virus, as we see what other states do, and maybe there emerges some additional best practices and so forth, these guidelines can certainly change. but we needed to get some information out to all of the local school districts and principals so that they could continue to plan for the resumption of school in August. So I did want people to know that, and I appreciate the work that went into that as well by Dr. Brumley and his folks and the folks over at the Department of Health. So with that, Don, I am going to give the floor back to you now, and I don't think I'm going to ask for it again. And Andrew, thank you very much for your work today as well.
Governor, I know you have to run, especially with so much going on over there in the legislature today. Stan Harris, though, may want to make a quick comment, and then I would like to give Terry Sterling a moment as well. But Stan's had this conversation. I know it's important, and I think he can reinforce how they're supportive of what you've conveyed to us today, sir.
Yeah, Governor, thank you. And thank you, Secretary Pearson, for allowing us to participate. To use the governor's phrase, you know, we may seem like we're done with the virus, but clearly it's not done with us. And getting people to be compliant and wear masks, we're engaging. We started Monday with a broad-based new campaign on placarding and hand washing, and just getting people to focus on common sense and getting back to where we were before we entered phase one, and reminding everyone of those good hygiene practices, those good sanitation practices, and really having that effective social distancing, and understanding while people want to congregate and get together, it's really our responsibility to manage those crowds, keep people apart. It's unusual for how we live in Louisiana, but recommending that we have people wear masks, it's a simple thing to ask, and our approach to it is, please do it for you, but also do it for me, because I'm serving you. So we appreciate the opportunity, Governor, to have the access. We appreciate what Chief Browning and Secretary Robinson, Secretary Pearson, Commissioner Lombard, and the whole team at LDH has done to try to help us get through this crisis. And we're going to continue to work together to come with good outcomes. And building compliance and building best practices is how we can work best together. And we appreciate all you've done to help us and get our industry started again in a safe manner.
Stan, thank you. And look, I know that much of my comments today dealt with businesses that may not be doing what they should be doing. I will tell you consistently, my conversations with Wanda Lombard at AT&C and with Butch Browning at the Fire Marshal's offices, that the vast majority of businesses are. Sometimes there's confusion, and when we visit them and we go over things, they quickly come into compliance. And so I don't mean to paint with a broad brush everybody, but what I don't want to happen is for us to have to reimpose restrictions on everybody, including those who are being very conscientious because of the few bad actors. And I use the word bad actors, you know, maybe there's a better way to say that. And so what we want to do is get more compliance, not have to go back and impose these additional restrictions. And so your help here is going to be tremendous. And I do want you to know, and look, I don't know the degree to which people really listen to what I say and heed my advice, but I'm going to continue to encourage people to not patronize businesses that are not engaging in these mitigation measures and in these restrictions because it's unsafe for them to do so. And so businesses who want to be able to have the most success and actually make sure that customers are coming in and that they're you know, profitable and so forth, they're going to need to get into compliance. And so I'm going to continue to do that. But anything you, Stan, and the rest of the folks who are leading these task forces can do will be greatly appreciated. Anyway, this obviously is not where I wanted to be today. And I think we can all agree to that. But we still have a chance to influence this, not have to go back with more restrictions and not run the risk of exceeding our capacity to deliver health care. But that's why this is required today. And look, I don't know that there's anything we can do where the numbers are going to get better over the next 14 days. That die is already cast. But if we all do our part, starting about 2 weeks from now, and the difficulty there is we have the 4th of July weekend, right?
Yes, sir.
Or the 4th of July holiday. I don't even know if it's going to be on a weekend in that time period. If you go back, we now can see that starting on Memorial Day, if you go 2 weeks past Memorial Day, you can see what happened. And so we all have lessons that we've already learned. For those people who thought the heat and humidity would cause this to dissipate and go away, we now know that's not the case. And so anyway, look, I do have to go. I've got a legislature in session. We end up no later than 6 p.m. on Tuesday night. We need to get a budget and get a few other things done. So I'm going to go work on that. Don, Terry, thank y'all very, very much. And look, anybody, any task force out there with questions, concerns, suggestions, whatever, y'all make sure y'all work through Terry and Don and get those to my attention. And I will do whatever I can personally to address those. Anyway, God bless y'all. Thank you so very much.
Thank you, Governor.
Yeah.
All right, before we return to our agenda, Terry, any comments? Sorry, you had some technical issues there this morning, I think.
Yeah, I think our new format is winning. Thank you, Don. I just want to echo the governor and Alex's point. One other point to make to individuals when you're having conversations is to remember our healthcare heroes. You know, when we were going through the peak of the virus, we were all celebrating those individuals who were on the front lines. And so many of them, they contracted the coronavirus, they gave it to their family, and just had really significant challenges in trying to serve our community. And so if we can implore our individuals to do it for themselves or to do it for each other, do it for those who work in the healthcare system who would be required to provide life-saving treatment. This is really about saving lives. You know, a mask is a simple thing you can do today to save a life. And you know, that's just one additional strategy. I know when I'm out at the grocery store asking, where's that mask? And, you know, encouraging people to pick one up. It's about saving lives. Thank you.
Thank you, Terry. Ms. Martin, did you have a comment?
I just quickly would love to applaud and encourage the governor that if we could convey what I think everybody's trying to say, and the way we're saying it is that right now, true hospitality is COVID courtesy. You taking the precautions, you not taking the precautions, and businesses not taking the precautions is dangerous to the rest of us health-wise and dangerous to our economy. And I hate saying this, but I think it's going to take the governor or one of the agencies shutting some folks down to get some folks in our industry and a variety of businesses to take this seriously. And I frankly hope they do it sooner rather than later, because some folks who are ignoring all this are really, it's maddening. And unfortunately, I think that's what it might take. So, but if we could try to use this terminology or thinking that COVID, you know, real hospitality, which we think of ourselves in that way, is COVID courtesy. That's it.
Thank you for that. All right, Andrew, take us back to our agenda then, if you would.
Yes, of course. So we are at Secretary Robinson, who has she would like to present to us a little bit. There was a request for information about the $300 million allocation into the Louisiana Main Street Recovery Program. Secretary Robinson, would you like to tell us a little bit more about that?
Yes, good morning. And we were playing musical login. So Alex BU was me, and I'm going to be Governor Edwards. So disregard the name you see. I'm not usurping authority over here. So the Main Street Recovery Program was enacted during the regular session, which ended a few weeks ago. It is Act 311, and it creates a $300 million fund for small business grants. The eligible businesses can receive up to $15,000 through this grant process, and the Treasurer's Office is expected to provide a program start date on July 1st. The Treasurer presented the program to the Joint Legislative Committee on the Budget this past Monday. The program is being developed in consultation with the Legislative Auditor's Office and with some assistance from some outside consultants. He's also working with the Department of Revenue because we have to provide information on the tax filing status of the businesses that are eligible for the program. So a few details on the timeline for the program. In the first 21 days of the program, grants are going out to businesses that did not receive either a payment protection program loan or a PPP loan from the SBA or an economic injury disaster loan. And just to give a sense of the businesses in Louisiana that received those loans, as of this week's update from the SBA, we had 70,573 businesses that received PPP loans for about $7.2 billion and 56,595 EIDL loans for about 180 million. So there are a large segment of businesses that did receive those loans, but there are still quite a few small businesses, and small businesses are those with fewer than 50 employees. And to ensure that it's truly a small business, there's also a requirement in the bill that passed, or Act 311, that you not be an affiliate of a business with more than 50 employees. So for those companies that have multiple entities, if you have one that has 50 or fewer employees, if it's an affiliate of your company, it's still not eligible for the Main Street Recovery Program. So after you get past the first 21 days, during the first 60 days, there's also a period set up where 40 million will go to businesses that are owned by women, minorities, and veterans. That ownership by women, minorities, and veterans requires both ownership and control. At least 50% of the business has to be owned by a woman, a minority, or a veteran. And there is a verification process that will be included in the application. And the Treasurer's Office has been working with Kalisha Garrett, who is one of our task force leaders, in establishing that process. They're also going to look to the Hudson Initiative at LED for those women, minority, and veteran-owned businesses as part of the certification or verification process, because we already know that those businesses are registered with LED. So that's one of the things that they can look to. So within 20 days of receiving an application, they will either pay or reject the application. And they are encouraging companies to start putting together the information for their application now. To be eligible, the business had to be domiciled in Louisiana as of March 1st. You had to suffer an interruption of your business due to COVID-19. You have to be 50% owned by one or more Louisiana residents, and you had to have filed Louisiana taxes in either 2018 or 2019. Now, if you were a newly created business that started in 2020, then you have to have plans to file taxes for the 2020 year. As previously mentioned, you can't have more than 50 full-time employees. You have to have customers or employees that come to a physical location. And you cannot advance partisan political activity or be a direct lobbyist of federal or state officials. The eligible expenses include costs related to meeting public health requirements for COVID-19, including creating social distancing, cleaning and disinfecting, purchasing equipment for expanding your facility to allow for teleworking, your reopening expenses, so for restaurants that may have done tents or outdoor tables, signage to tell customers how to distance 6 feet, if you installed a drive-through window, if you did contactless equipment like credit card readers, if you bought laptop equipment for your employees to work from home, and also the purchase of personal protective equipment. They're also planning to cover business interruption costs, including inventory replacement and mortgage interest. Ineligible expenses are lost profits or lost revenue, any damages that have been covered by insurance, and costs that will have been reduced by any other federal or state program. They're also not covering severance pay or legal payments. There's a website that should go live. Well, today's Friday, so I'm thinking the go live will be Monday or Tuesday of next week, but before the July 1st launch date. The application will be fillable on the website. Most of the questions will be a checkbox to confirm certain things like, were you a Louisiana business on or before March 1st? There will be a verification process where they can verify with the Secretary of State that your business is in good standing. Sometimes we, as business owners, forget to file that annual statement with the Secretary of State. So if you're a business owner and you need to go check the Secretary of State to make sure you're in good standing, just an FYI thing to go do. You're going to have to include certain things on the application, your federal tax ID number, your state tax ID number. Those are things that they're going to use to verify that you filed your taxes. And they're going to try to make this as seamless and easy as possible so that they can get payments out within 20 days of the application being received. And that is the general overview of the program. And I will take any questions that anyone may have. And I see one in the chat on when can we start filing the application. As soon as the application opens, the treasurer will announce that date on July 1st. And you'll be able to get program updates at latreasury.com.
All right, great job, Secretary Robinson. Thank you for sharing that information with us this morning. And it's a rapidly developing program, so we'll continue to monitor the Treasurer's website for all those important updates and the ability to do the filings. And certainly with our small business support hat on over at Louisiana Economic Development, we'll continue to message this opportunity out to all our stakeholders.
All right. And I'm trying to see if there was one more question.
Will they consider LLC partnership distributions, I think is something around that.
Yes, so if you are an LLC, you will just need to submit in the name of the LLC and provide the members of the LLC. There will be information on that, but the way that we will track that information will be included on the application as far as the LLC's tax ID number and then the members, so that we can confirm that more than 50% of the business is owned by Louisiana residents. That LLCs, partnerships, sole proprietorships, and corporations are all eligible to participate in the program.
I know there may be some more questions on the program, and we'll try to circle back to those. Again, it's early on, and we'll help address those that are in the chat room now. In the interest of time, I think maybe we need to continue with our agenda.
Thank you.
Thank you, Secretary Robinson.
Thank you, Secretary. The next item on our agenda is a presentation by Jade Brown Russell on equity as the superior growth model. I'll turn it over to you, Jade.
Thank you, Andrew. I am going to share my screen. Good morning, everyone. Let me move this around. All right, can everyone see the screen? Uh-oh, it went to the end of the presentation rather than the beginning. Let's see. All right. Good morning, everyone. I do want to thank Don, Terry, of course, Andrew, and others on the team who have really pushed this conversation forward. Also want to thank the governor and Secretary Robinson, who continue to do the work that supports the most vulnerable. We just heard about the Main Street program, recovery program, and we're looking forward to that being rolled out. And lastly, thank you to the task force leaders and the members who really did the work, and it shows in so many of the task force reports. And I actually did get a chance to go through all of them. I was really just grateful for the task forces really embracing what oftentimes is a very hard and uncomfortable conversation, but it is definitely a necessary conversation. So I always think that it's important to start things with defined terms. Of course, we talk a lot about equity, but a lot of people don't really understand really what it is. And so it is the just and fair inclusion into a society in which everyone can participate and prosper. And we should be underlining and underscoring everyone. Our charge has really been one that is important because we want to make sure that we are reimagining systems that not only produce change, but that change also needs to be sustainable. And I think that is something that we often miss. Our methodology here was really quite simple. Review all of the reports, identify the cross-cutting themes that emerge from those reports, and present to this body, to the commission today, high-level recommendations for the commission's consideration. In preparing these, I wanted to try to keep these recommendations high level for now, because there's still a lot of work that we have to do that's ahead of us from a systems perspective, but also as it relates to the system component parts, that being the sectors and the organizations and agencies that support each one of those sectors. It's going to be very difficult for us to do things at a government level, and we're going to talk about this a little bit later, and it not trickling down or flowing up to our business sector, our private sector, our advocacy circles. All of those need to be tapped in and working together collaboratively. In preparing for this presentation, it's interesting. I was asked the question, you know, we are talking about it, but how do we get to the how? What are we doing right now? What we're doing right now is a major, major part of the how. The how includes an acknowledgement that we need to reimagine this, right? The how includes education and assessing and understanding our current position, but also being clear about where we want to go and what we want to see happen on both the macro and the micro level, and create strategies around that to get there. It's no different than a plan that you would put together in a corporate setting, where you know where you are, you know where you want to go, and you develop a plan to get there. That's exactly what we have to do as it relates to equity. Inequity is a skillful deed, and it is attended to daily. For every action, there's an equal and opposite reaction. The work we're doing right now is that equal and opposite reaction, and we must attend to this work daily. The rationale is really important because we have to know really where we are. I just talked about that, understanding where we are. And if you look to the right of this slide, we can see what the current model is producing in Louisiana, right? We're the second highest, we have the second highest poverty rate, the third highest child poverty rate, the fourth lowest median household income, the second highest income inequality in the entire United States, right? So what we see in our current model is it is not producing the outcomes that the people of Louisiana really deserve, right? We have a model currently that is filled with social inequities on many levels, including age and race and gender and geographics. We're talking about our rural folks, people with disabilities. These all produce the outcomes that we've seen. And the data is the rationale for Louisiana seeking a new growth model. We talked about this with Angela, a new growth model that builds on our assets and brings us closer to the idea of prosperity for all. Just more on rationale. Again, if you look to the right, additional statistics, we're 49th in the nation on a test of the college readiness, which is through the ACT. We're 49th in child well-being. Again, just supports this discussion about us not being where we should, right? We're all working in our own silos and we're not producing the results that Louisiana deserves and its people deserve. Angela Glover Blackwell, which I was excited to actually see a lot of our task forces referring to things that she said in her discussion. She imparted words of wisdom on us about equity being the superior growth model. It is an economic necessity. And the Annie Case Foundation is the source for some of this data that we're presenting, and considers all kinds of metrics on education and child well-being. All of this data matters, but we cannot do this work in silos. The entire system needs to buy in, including all of the sectors and the agencies that drive them. All should be laser focused on developing equity plans, singularly focused on changing outcomes for our most vulnerable. And the governor has really given us this platform, amongst other things, to do just that. So here, these are just some of the health metrics that we've seen, and they actually align with so much of the other data that I presented on the previous slides. We're all the way at the bottom, guys. We're in infectious diseases, cancer, cardiovascular diseases, diabetes, behaviors, community and environmental factors. We're at the bottom as it relates to our counterparts across the state. Again, Louisiana, we know our people deserve better, and we have to be the body that helps shift that needle and pushes us in the right direction. So this slide is really the core of the conversation that we had with Angela about equity being the superior growth model. What does that mean? It's a model that is driven by equity. And really what it does is it combines two separate agendas that are typically working in isolation and in silos. The first component of those two agendas is growth. We know we need to grow new jobs and bolster long-term competitiveness. We've talked about this time and time again on many calls, but also we need to couple that with equity. And we need to ensure, again, that all people, everyone from low-income people, rural people, people of color, all of the vulnerable populations that we have, they have to have the opportunity to benefit from and I underscore here, and co-create the growth that we need to see. Equity and growth need each other more now than they ever have. And we know that this is a proven model for success. And we have to get to the point where we understand we all can, this is a win-win. We all can benefit from equity. So I wanted to use this time to really talk about what our task forces said. And these are not my words, these are actually their words. I promise you, I've gone through all 500 plus pages of the recommendations submitted by all of the various task forces. And I was really just enlightened. First of all, of course, we have some super talented people that have a high level of expertise, and we need them in order to produce a more resilient Louisiana. Some tackled equity a lot, and some tackled it very little. Some used the word equity and others didn't, but it's still, the concept of equity still flowed through every single sector. And I thought it would be a good time to highlight some of the things that the task force has said. So I want to note that these are not necessarily from the various sectors, but I grouped these highlights by topic, right? So there were some cross-cutting themes, which we'll get to. For example, you'll have the Education Committee talking about something that may not have been education related, right? So when you see the notes to the side of the comment, it's not necessarily from that sector, but it's on that topic. So I start here with education, and we talk about us not having and needing a more highly educated state with a more diverse economy. The economic impact of this health crisis on Louisiana would be much different. That was a huge statement because it shows the correlation between the health outcomes that we see and the lack of education. And the state as a whole should maintain a strong focus on the Louisiana Board of Regents master plan attainment goals during this time. What struck me about this statement was the Board of Regents already has a plan that incorporates equity. So what we have to make sure that we do is we have to make sure that we're paying attention to those agencies that are already highlighting equity, but we need to be able to support them in making sure that they execute on those things. Education and training programs, this is on workforce development, should include pathways for undereducated and formerly incarcerated residents. This was a big statement. As of 2015, nearly 50% of Louisiana's working adults were disconnected from employment due to lack of skill and or education. Neither our economy nor our state can thrive without engaging a greater percentage of our workforce. We're leaving 50% of our working adults behind. And so we have to make sure that we're standing up our education and workforce efforts to improve the outcomes. So this is a highlight that focused on both of these on small businesses. Support policies that encourage private investment in small businesses. Similar to other proven policies, the private sector can be a critical partner to taking our businesses off of life support. And we have seen the governor and Secretary Robinson just briefed us on some of the things that are happening for our small businesses. Our Main Street Recovery Program. We have to make sure that these dollars are not only utilized, but utilized in the way that benefits all Louisianians in an equitable way. So when we talk about the $40 million for minority businesses that is set forth in that bill, we've got to make sure we're looking around corners and ensuring that those minority businesses actually get the $40 million, right? And that it's marketed well, that we are making sure that the resources available are reaching the community. The next one is Louisiana should tap into an existing network of federally licensed SBICs and rural business investment companies. This is a small business comment, but I believe this one was made by our Economic Development and Community Development Task Force. So that was a great one as well. Wages was a big topic that came up throughout the task force reports. And I won't read this entire one, but it talks about literally if poverty, I highlighted the important pieces. If poverty was a city, it would be the biggest in the state by a factor of 2. Right. So we know that we have a really horrible poverty issue in the state of Louisiana. We have to change those outcomes. And the recommendation was to do so in part through the state's earned income tax credit or by establishing a minimum wage higher than the federal minimum wage of $7.25. And that came up repeatedly in some of the task force recommendations. The affordable housing piece, although we didn't have, and I've had several conversations with our commission leaders and others on the topic of housing. While we did not have a housing task force, affordable housing continued to present itself. And I think that is in part because, of course, housing is a critical need, regardless of who you are, regardless of what your earnings are. You have to have a place to live, and you have to have an affordable place to live based on the wages that you earn. And so this recommendation really just focused on how to utilize various sources and financial resources to support and retain mixed income housing and affordable housing for seniors and other vulnerable populations. This next slide, again, focuses somewhat on small business and education, two big topics. Expanding the enterprise zone tax credit for small businesses in the hospitality industry, including restaurants and hotels and other hard hit industries. Also on small businesses, this is something that is already being done, which is the conversation we just had with Secretary Robinson with the CARES Act and the federal stimulus money, leveraging that and making sure that we are incentivizing corporations to utilize and incorporate best practices and principles. This concept of incentivizing best practices is very attractive to me as it relates to equity. If we can really put our heads together and figure out a way to incentivize even issues like equity, we will be able to move the needle on progress for our state. And then lastly, determining the strategies to establish safety nets, educational opportunities, and support programs that improve the quality of life. And also allow folks, again, there it is again, allow them the chance for a higher living wage. And so we know that this is critical work. On the small business front, we also have to provide incentives for small businesses to complete necessary retrofitting for COVID-19. And so this really speaks to me, and it also piggybacks on what T. Martin just talked about with making sure that, you know, we're protecting everyone. We're thinking not just about ourselves, but also thinking about everyone else, right, at the same time. And so this is something that was interesting to incentivize small businesses to retrofit their businesses for the issues that we face with COVID. This came from a comment. The second one comes from a comment from the rural task force, and I loved it. It really didn't hit on a specific topic, but really focused on what our state of mind has to be in this regard. Nostalgia makes for good memories and contributes to a strong sense of place, but it makes bad policy. The direction of this work is unapologetically forward. And I think this is the mindset that we do have to carry with this work. This is not going to be, it's simple work, but it's not easy by any stretch of the imagination. And I think we have to come to grips with, just because something has been a certain way for as long as we can remember, and for generations before us, it does not make for good policy for Louisiana. We go back to the data that we talked about on the front end. We're not all okay. And so we have to make sure that we're doing things to position everyone to be okay. And then we have another comment about clearing the entrepreneurial path and creating pathways for easier pathways, better pathways, reducing licensing requirements for the creation of entrepreneurial efforts, and making sure that we're removing those barriers that exist so that we can create and build and sustain more small businesses. Health equity, this first highlight is not one that is surprising to any of us. We've heard it over and over again, but I thought it was worth highlighting in this report. Exacerbated by the longstanding health inequities in the state, 50% of our COVID deaths in Louisiana were African American. And so we cannot ignore that data. It is a telling sign of the place where we are right now in this state, the things that we have overlooked or refused to look at are affecting us and now affecting our entire economy. And so we have to respond to that. Lastly, the tourism and wages, a large percentage of travel industry workers are minorities and others on the lower end of Louisiana's economic spectrum. This virus has more widely affected and exposed the needs that exist for this vulnerable part of our population. Additional equity conversations, research, education, and resulting strategies must be immediately conducted, created, and implemented for true resiliency to form in every economic sector, especially in the hospitality and tourism sector. And I think there's one more actually, I think there may be two more because I split some of these slides up. The digital divide was a huge concern, and it did not just appear in the IT task force, the IT and communications task force. It appeared in other places as well, including education, and as well as some others, economic development. We absolutely have to address the inequities that are related to the digital divide, as well as diversity and inclusion in the IT sector, which is critical to resilience in Louisiana. So correcting those systemic failures and inequity, again, quoting Angela, is both a moral imperative and a superior growth strategy that will benefit the entire state. We also have to focus on solving the remaining problems of connecting those that do not have internet and redouble our efforts to address the adoption problem we face in Louisiana. This is something that Sonia raised in a prior meeting. Based on the data from FCC, the share of Americans who have access to fixed broadband but do not subscribe is about 5 times the share with access to broadband. And so we've got to make sure we're closing that divide and creating more opportunities. Transportation made just this great statement that to truly make a long-term recovery, which is resilience, we must make people our priority and be honest about racial and ethnic discrimination in the delivery of infrastructure. They really went into how they want to ensure that they create just a more robust and intentional, not only policies, but transportation systems. And so I really appreciated their report. There is an opportunity this is on food insecurity. There's an opportunity to enhance vegetable and fruit farming and also help disparities in communities that have food deserts. There is the need for small scale packing houses for fruit and vegetable growers, which can be done collectively as a farmers cooperative, thus allowing someone to grow a product and get it into the retail supply chain. This was so important to me and enlightening to me because the issues that are faced in the rural communities of Louisiana are some of the very same issues that are faced, for example, in the lower Ninth Ward community of New Orleans. And so there is common ground there, and we should be fighting on that common ground together. So that was very important. Those are all of the highlights. I did want to then kind of culminate those highlights into the cross-cutting themes, the things that just kind of transcended across all of the various task forces. And these are the cross-cutting themes that emerged. Education, we have to better educate our people. We've already seen the data on the front end of this presentation, and we don't probably don't, we will have to keep looking at it again, but for purposes of this presentation, I think we get it. Workforce development, of course, goes hand in hand with education. We have to ensure that we are preparing people for an evolving workforce, and we have to pay them the wages, which is also a cross-cutting theme. We have to pay them wages that support them living a great quality of life. Small business growth, which we saw a lot in many of the task force reports. We have to be able to stand up and lift up and scale up small business growth. I was going to say New Orleans, Louisiana has such a high, it's in the 90 percentile of small businesses. We are a state of small businesses, and we have to make sure that we're putting them on equitable ground to be successful. Housing, we talked about that already, affordable housing, ensuring that people have appropriate options for affordable housing, food security, broadband and digital divide, health investments beyond clinical boundaries. We often talk about health investments as they relate to directing people to access within hospitals or within clinics. We have to go beyond that and make sure that we're investing in our communities and connecting health opportunities to them, meeting them where they are. So when we talk about recommendations and the path forward, I really want to emphasize that these are high-level recommendations, and there's still additional work to do, and I'll talk about that on the last slide. But the first recommendation is to educate all on equity and resilience. We talked about the two agendas that have to be combined, growth and equity. They have to come together, and we all need to really stretch outside of our comfort zones. We all are gonna have to get comfortable with being uncomfortable because equity concerns must be accounted for. And the resources that are made available when we address these inequities, we have to ensure that those are actually being communicated and allowing our community, our advocates, and as well as our private sector to be a part of those conversations. So we talk about private sector leaders. We'll need you all to embrace and prioritize equity concerns, and equity-oriented voices need to be able to join traditional business and economic growth forums. We have to have everyone at the table. Growth advocates will need to stop seeing equity as something that hopefully trickles down from their efforts to attract and grow businesses, and recognize that racial, gender, and economic inclusion will help everyone and will help them achieve their primary goals of growth and competitiveness. And then equity advocates, we also have work to do. We have traditionally been focused on how the benefits of growth are divvied up. We've constantly been consumed with percentages, right? We will need to concentrate more on generating job growth and choose strategies that work with market forces to reach our equity goals. We all have to work hand in hand together. The second recommendation and path forward is creating a place where equity lives. This is just so important. Someone or some agency has to own equity. Specific measurable objectives have to be created for each cross-cutting theme that we've already talked about. Those measurable objectives then have to be prioritized in collaboration with task forces and then tracked through a newly created, what we're recommending, a statewide Office of Social Equity that will focus its efforts on engaging in methods to prevent and reduce systemic inequities identified by the task forces and other equity stakeholders. This Office of Social Equity would also be responsible for measuring Louisiana's equity and social vulnerability. We have to know where we are, and we have to assess whether our communities have the necessary infrastructure to assist our most vulnerable, especially in times of crisis. We can create strategies and plans, but if our communities don't have the necessary infrastructure to receive them and to implement and execute them, we're literally creating plans that are destined for failure. And the last on this slide is the Office of Social Equity should be also responsible for employing the equity lens that we talked about and ensuring that principles of equity are embedded in decision-making and policy-making. The voice of equity must be at every table and in every room. And so when we talk about that equity lens, this is literally employing an equity in all approach. Every policy, every law, every bill, we should be looking at those, not just for the various sectors and goals that it's trying to achieve, but also, is it equitable? Are the devil is in the details. My grandmother would say, God is in the details. We have to ensure that we're looking at everything and understanding the impact that it'll have on equity or the lack thereof. We also have to commit to tracking metrics that inform equity outcomes. One of the reasons that we see programs that are designed to affect equity and impact equity, one of the reasons that we don't ever see that progress is because we're not tracking it. And so for equity-driven growth to become the reality, we have to prioritize, track, and measure gender and economic inclusion alongside all of those traditional measures of economic growth. Equity now should be a part of that. Through the use of sector equity report cards, equity advocates should also hold policymakers accountable for the consequences of their policies, monitoring them for the decisions that they may intentionally or unintentionally push different groups away from each other and widen current economic and social divides. So one of the things that we see, and we see it all the time, is that there are unintended consequences to policy. We have ordinances and laws that are put on the books where we actually never even thought about the impacts that it will have on a vulnerable community, right? Or we haven't even considered how this pushes certain groups away from each other. And so we have to examine inequities, and we have to do so through a data-driven approach. So we have to not only be able to report out on our equity efforts, we have to be able to track it. I will tell you, one of the most difficult things in this process was getting accurate data that is segregated by race, ethnicity, gender, disability, zip code, et cetera, right? So we have to be intentional about the data that we're producing and the data that we're making public. I am finished, and I will open it up for any questions if there are any.
I have a question. Jade, thank you for that presentation. That was exceptional. I'm curious to know, an Office of Social Equity, are there examples of this being implemented in communities across the country, states, cities, otherwise, just so that there would be some guideposts that we can look at for achievement?
Yeah, absolutely. There are several states as well as cities. There are a number of cities. Actually, New Orleans, a few years ago, this was after Katrina, they created, under Mayor Landrieu, created an Office of Equity and Resilience. I don't think that office is currently the same. I think they've restructured it. It's under a different name now, but that's one example in the state of Louisiana. But there are a number of examples across the United States in states that are progressively pushing this agenda. So I can definitely share that with you, but we wouldn't be recreating, the wheel here. There is precedent. Absolutely. Great
Excellent.
question.
Yeah, thank you.
Atlanta has a very progressive equity. I think it's called One Atlanta. It does more than just, it's an Office of Social Equity, but there's a lot that runs through there.
Yeah.
Some of their housing development, it has long tentacles into economic development in the city.
Yeah, so it certainly has an economic development component that you would expect this to be sort of, you know, you don't have to create something entirely new. You can house it within, you know, it's a superior growth model for economic growth. And so it should be incorporated there. It makes sense. So
Right.
thank you.
Great presentation, Jade. In the first group of recommendations, I mean, your actionable items in the Office of Social Equity and then equity outcomes, how do you summarize that first slide into kind of a global action item? Is that in partnerships? Is it awareness? Is it education? How would you summarize that into, you know, there are tactics there, but I was looking for a little more global and packaging.
Yeah, I think it speaks to collaboration and partnership. I absolutely believe that. I don't think, let me say this, I think we have done some of this work in silos, right? So, you know, we, for example, in government, we have DBE programs, we have we have SCB programs at the state level, right? You have some private sector agencies and organizations that have created some diversity plans. So we're all kind of working in these silos, but that work has to be done collaboratively. So if I wanted to summarize that particular slide, it would be collaboration, it would be partnership. And I think one of the things that is often missed is the presence of equity advocates, right? And the reason I believe that is because equity advocates come in all shapes, sizes, and colors, right? And many times what happens is, and I'm just being super transparent, many times what happens is those who are on the receiving side of their advocacy are not necessarily aligned with how it's delivered. And we have to get beyond how it's delivered and really listen to what our advocates are saying, right? Regardless of how that information is delivered, look beyond that and understand what is at the core of what they're saying, because 99% of the time, there is some truth in what they are saying. And so I think that slide is really culminated in the spirit of collaboration and partnership.
Great, thank you for that.
You know, it's a great presentation when people are already asking for it on chat, Jade. So
I will send it. I'm happy to send it to anyone.
And certainly we want that at LED to incorporate into the document and our plans going forward as well.
Don, let me. Oh, go ahead. I'm sorry.
No, I just wanted to
hey, Corey.
make a comment. This is Corey. And so, first of all, Jade, thanks for the information. Really appreciate it. I do agree. The more we can make equity, we can show the benefits to the bottom line. Ultimately, I think that will drive our efforts in being more equitable. So I agree with you on that. Also, one of the things that you know, I guess I was daydreaming about in order to sort of move the needle on this, and certainly can discuss it further, but if there was some sort of equity scorecard, right, in terms of different agencies or businesses or whatever you want to do, if there's some sort of criteria we can lay out, similar to how people look at schools and determine what schools are doing well based on the letter grade. That's a long range. I mean, that's a big thing, and you know how you do with the criteria and all those sort of things. But the more tangible we can make it for people to understand who's doing well, who's not doing well, who needs to improve, I should say. I think that the better we are able to move the needle on that. And finally, I'll say I look forward to working with you soon. Jade is too professional to say this, but Jade does. She's a DBE herself, and she's going to come in and help our organization, BREC, be more equitable and look at what we're doing internally. So that opportunity is available for you all as well. So thanks, Jade.
Thank you, Corey.
Secretary, if I just wanted to also tell Jay that I appreciate the report, and it's so long past time for these improvements, and we need your guidance. So thank you. And when this discussion is over, I unrelated wanted to ask if the co-chairs would consider a motion.
Thank you. I'm looking at time right now. I'm seeing it's 11:30, and I'd like to recognize that there is a quorum, so a motion can be entertained with Terry Sterling on. We do have 10 out of 18, which makes it a quorum. So if we'd like to transition on to that, is there anything else first for Jade? I know we've had a lot there, and it's a lot to absorb.
That's right. Let's be sure we close out the equity, and then we'll move to you, Ms. Martin.
Yeah, so Andrew, Secretary Pearson, this is Kalisha Garrett. I have one statement, I guess, and a question. First, wanted to share that in working with LED's office in Alliance for Economic Inclusion, we have been tracking and looking at ways to improve more transparency around the Hudson and veteran spend with the state as a whole. One of the initiatives that I know that our group is going to be diving back into will be looking at how we can expand that across all entities, being departments and quasi-governmental agencies that are utilizing any tax dollars for contracts, and seeing how we can ensure that there is some component of compliance around that. And how we can increase the use of our local vendors, and looking at that from a lens of either expanding what is on the books as a local first program, or looking at ways that we can legislatively have some additional compliance throughout the contracting process. I know Jade Arden's office has been very open and transparent, and we've been working with them through Louisiana Checkbook. And I'm also very appreciative of the legislative look that is outlining the minority and veteran spend in some of these contracts. But we have a great opportunity with some of the infrastructure programs and the coastal restoration programs that are going to be coming through the state. And I'm asking the commission if they would carry that back and ensure that we are expanding the use of these businesses, as well as looking at ways that we can collaborate from a more equitable stance, even if it's on a tax incentive base or some form of incentivized program that can be given to either investors or large corporations on a metric that increases as they increase more minority, diverse, or local business use. So that would be my question. I don't expect an answer today, but I'm just asking for consideration on looking at those points and understanding how we can track compliance from the start of a program or project notice to proceed throughout the life cycle of that contract, because that's where a lot of times the good will or the good faith efforts fail because they're not tracked during the process of the contract and execution. So thank you again. Thank you, Jade, for your presentation. Thank you, Andrew and Secretary Pearson, as well as I think Secretary Robinson has dropped off, but the rest of the commissioners and Ms. Sterling for your tenacity and support throughout this effort.
Thank you, Kalisha. Yeah, it didn't feel like a question, but I am glad that you surfaced that LED, the division, other branches of government have been actively engaged on this front, and we want to continue that. And I think you brought out some great points about the $1 billion annual spend at CPRA and some other pathways that we want to continue to aggressively pursue. And we will certainly do that in partnership with you and a number of Myra's on the call as well. We want all of these agencies involved, and we'll continue that collaboration. Any other of our comments relative to Jade's presentation before we pivot to a request from Ms. Martin? Hearing none, Ms. Martin, please address your commission.
Thank you. A motion, if you all would consider it, would be the following: to not give up the gains that resulted from the sacrifices our state has already made, and to support our governor's efforts to lead the state to a stronger, faster recovery. We support the governor in doing all in his power, including shutting down businesses and setting up a number to enforce non-compliance in order to enforce the requirements already in place.
I might wordsmith the shutting down a little bit. Walt Leger might be able to help me with that. but words to the effect of enforcing it to include temporary closure or something to that effect.
Yeah, that's what I meant.
Yeah, I'd be happy to try to help, and I support the motion. I agree with kind of tweaking the language a little bit. Could you read it one more time, Ms. Martin?
Okay. We'll try to change that. To not give up the gains that resulted from the sacrifices our state has already made, and to support our governor's efforts to lead the state to a stronger, faster recovery. We support the governor in doing all in his power, including temporarily closing businesses and setting up a number to enforce non-compliance in order to enforce the requirements already in place.
And then you have 700 people in the hospital.
T, would you be able to type that into the chat? Is that possible?
Well, I'll give it a shot here.
I'm sorry.
That's okay. Let me see. I mean, I hate to take all this time for me to do that, but
Walt, help me here. Is it a resolution? Is it just the authorization for the co-chairs to make a public statement? How should we format what T's intentions are here?
Yeah, I think it makes sense for it to be a resolution of support. Although I think we could fashion it as authorizing the co-chairs, and that way we could create a little bit of flexibility with the wording.
T, is it possible for you to share your, I'm sorry, Walt, go ahead.
I certainly have absolutely no objection to the sentiment, and I support the sentiment. I think probably most of us do. But we also are all cognizant of trying to get the verbiage correct and accurate so that it can be received in the best possible light. I share Ms. Martin's passion for enforcement being often necessary to ensure that the best outcome can occur for those businesses, as the governor referenced, are largely and uniformly applying and complying with the regulations that have been laid out. So I share the sentiment.
As I read that, then it may be that we want the flexibility to put that into a public statement with the board's approval. T and Walt can work the language and then get it to Terry and I, and we can put it out through media later today if the board so agrees. And then if we want to formalize it at our next meeting to go back with a resolution for the record or something of that nature. But I think speed to market may be what you're looking for here. And the language is delicate, needs to be correct, as Walt's pointed out. So that would probably be my preference personally. Terry?
So our motion is to endorse the development of a position statement as it relates to the governor maintaining the gains and moving toward a methodology of enforcement that would then be developed by a group and then issued as a statement, and then subsequently then a resolution. Is that accurate?
Yeah.
Yes, I think so. I think sometimes it's hard to present a resolution in this format without having had the opportunity for multiple people to sort of weigh in on the crafting of it. And this would allow there to be the public statement of support and also the formality of a resolution at the next meeting so that everyone would be comfortable reviewing it.
Okay. Just to clarify, is this the same thing as authorizing the co-chairs to make that statement so that the speed to market is supported?
Yes, I think so.
Yeah, I would hope so. And I have no pride of authorship. So I'm on the same page here as what Walt is suggesting.
Yeah, and I think it's actually authored quite well. I just think it's a matter of tweaking just a little bit of it to make sure that it's received in exactly the sentiment that it's being expressed, which is broad support for economic reemergence and broad support for our small business community and our businesses, but also the recognition that that comes with the need for strict application and enforcement when necessary to ensure the public good.
And COVID courtesy.
Yes.
Yes, I love that. See, I love it.
We all like to think of ourselves as courteous, don't we?
I think we have what Terry's captured here as a motion. So as a commission member,
I would second.
got a motion and a second. Discussion by the commission members. Hearing none, I'm hoping that's because people did come off mute if they wanted to make a comment. But with that, I will ask for an indication, and you may wave your hand, raise your hand by saying aye.
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 Any opposed?
Aye.
All right, I think we're good then. We'll proceed with that this afternoon. We'll close out with any other business. I know the hour grows late. I would like to just for a moment call on James Chappell for a report on our work towards the document for charge 2.
Thanks, Secretary Pearson. Yeah, just a quick update that my team within LED, we've gone and are going through the, as has been mentioned, the 500-page report. And as we just saw from the equity presentation, there's a lot of really fantastic work that's been done. So what we're really trying to focus on is to carefully go through and identify those major themes that have emerged, and then also to fill those in with what we think kind of works best, the good initiatives, strategies of what works best, not only from a feasibility standpoint, but trying to craft things that kind of fit together in a holistic approach to make sure we're hitting kind of all the major areas theme-wise, and then kind of a top-down approach and a bottom-up, more longer-term initiatives that would improve the foundation of the state. So we're going through it and have made a lot of progress on identifying and pulling out things for a commission summary. And we'll continue to work on that in the coming days, but just a lot of good stuff. And we want to make sure we take the time to get it right. And that it really is the best presentation of all the good work that's gone in from all the task forces.
Thank you, James. And for the commissioners that are still here with us, again, there's a great deal of focus on this. We want to get it right and then take the time necessary to get it right. You've given us a tremendous volume of great information, and we're hard at work in translating that into some things that'll be actionable and important going forward. That concludes what I have. Terry, anything?
Don, just one point of clarification, and since James mentioned kind of the thoroughness, is that to suggest potentially we had asked the commissioners to do a save the date for both the 10th and the 17th, knowing that we would take next week off? Is there some indication of when we might then have our next meeting, the 10th versus the 17th?
I'd like to keep both dates in pencil. And again, as we've done in the past, maybe we would be hoping to bring a framework and maybe something less than final on the 10th. And by the 17th, have a completed document allowing the commission to see the framework, raise any questions or concerns.
Andrew, I'll ask if you would just go ahead and just post a simple save the date to the members for both of those times, as people are getting back to work and their calendars. It would be helpful just to see that as a save the date for a potential meeting on both of those Fridays.
Sure, I'll take care of that. No problem.
Thank you.
Any other comments for the good of the group? All right, hearing none, we'll entertain a motion to adjourn.
Well, I'd like to quickly note that in the chat box, usually we have a time for public questions and comments, but I want to let the public know that in the chat box, we've been receiving those through the emails that were requested, and there's been answers posted. If you haven't seen those, Secretary Pierce and other people have responded to the questions that came in.
Thank you for that. Kim, anything that you had to add?
No, I was just going to say thank you to the commission members. I'm sorry I had to drop off to join another meeting. So my absence, I was able to get back for T's motion. So thank you all very much.
Great. Well, you missed a great presentation by Jade, but we'll catch you up on that later.
I hate missing when Jade presents.
Thanks, Secretary.
All right. We stand adjourned, and thank you for your time and your diligence here.
Thanks, everyone.
Yeah.
Have a great week.
Everybody take care.